The first speaker will be Katie Greenland, if she's here. Katie, I don't know by sight. Good. And I'll let you introduce yourself, and please try very hard to keep to time. Thank you.
Good afternoon, everyone. My name's Katie Greenland. I'm a researcher in the Environmental Health Group at the London School of Hygiene and Tropical Medicine. That's the group that's headed by Professor Sandy Cairncross, who some of you may know. I'm not going to be talking about groundwater, but some of our research in hygiene, particularly hand washing, and how we get people to change their behaviour. So where does hand washing matter? These are just a few examples of some times when it's really important that hands are washed and with soap. So we see here after defecation or cleaning a child, before preparing food, before eating and before feeding a child, and of course in hospital environments, healthcare settings, such as here at a delivery. And we're particularly interested in hand washing around defecation and around food events, and that's because of the impact for prevention of diarrhea. But do people wash their hands with soap at these times? This is a table that shows a summary of hand washing studies done in 13 different countries. Just want you to focus on this column, which shows when people were washing their hands after using the toilet. And this was done by observation, so observing people using the toilet and seeing whether or not they washed their hands with soap afterwards. And you can see that on average, only 17% of the time somebody used a toilet, they washed their hands with soap afterwards. So why don't people wash their hands with soap after using the toilet or any of these other occasions? This is a model, it's called the EVO-ECO model, that was developed at the London School by my colleagues Bob Oranger and Val Curtis. And it describes the determinants of behaviour. Particularly, we focus on health behaviour, but it applies to many other behaviours. Now, a lot of the times when we want to change something like hand washing with soap behaviour, people focus on knowledge. They think, okay, we'll tell people about diarrhea, we'll tell them about germs, and we'll design hygiene education materials, and that will change the behaviour. But time and time again, when these studies are evaluated, the programs haven't been effective. And that's because people focus, see in this blue box here, on the executive part of the brain. So this is giving people knowledge, when actually behaviour is determined by a whole suite of other things. So in the brain, also, we see it's determined by our motives. So for example, if my hands are sticky, I might want to wash them. I'm disgusted by that. Also, the reactive brain, that's to do with cues and habits and routines that we have. So seeing the soap next to the sink in the kitchen might make me think of washing my hands before I start preparing food. The green boxes, just to briefly go over them, refer to the environment around us and how that can make what we want to do easier or more difficult. So the social environment, for example, what our family and friends do, and the fact that we want to adhere to social norms and behave like other people. The biological environment, in many of the places where we work, there's a lot of environmental contamination. So when there's feces everywhere, people are less bothered about doing something about it. And the physical environment, which refers to how easy or difficult it may be to wash your hands if your latrine is shared with many other houses and is not that close to you, or if you've open defecated. So the reason why we're interested in learning about the determinants of behaviour is so that we can intervene and try and change them. These are just some examples of some of the things we might try and do. So if we just look at the motivated box, you can see we might want to try and elicit disgust or a nurture instinct in a mother, or affiliate hand washing with soap with status, or affiliation with other people, that everybody's doing it. And some of these different things are what we've done in a hand washing trial. So this is how we try to change behaviour. And we did a trial which is called Superamma, which means super mum. And this was in rural Andhra Pradesh in India. And I'd just like to show you a short film that describes the trial and the findings. Film, please. So the findings there were presented very simplistically because the film is very much for an everybody audience. I just wanted to show briefly what we actually did. And in red, you see the intervention villages, and blue, the control villages. So at baseline, hand washing rates at key times, that's around defecation and food-related events, was very low in intervention and control sites. The first follow-up visit was 6 weeks after the intervention, and hand washing increased in the intervention villages. And the second follow-up was 6 months later. For some reason, hand washing increased even further. We think perhaps that was to do with social norms and behaviours becoming more instilled in the village. And then the intervention was run in the control sites, and a further 6 months later, we see that hand washing levels increased in both villages. So just before I conclude, I just wanted to show you briefly some of our work which is a bit different, and to show that behaviour is determined by many factors, not just education and germs. And behaviour change is essential for the success of most public health interventions, but it is hard to achieve, and there's a lot of theory that goes behind it. So when we base our interventions on behaviour theory, we're more likely to be successful. These references and the other key people involved in this work. Thank you very much.
Bill Peacock from Water and Sanitation from the Urban Poor. Will you go back and look in another year's time? Because we've done quite a lot of work in a number of our countries and found the drop-off rate, as time goes on, does get worse, let me put it that way. Mm-hmm. Trying to get the sustainability is really quite hard.
Yeah, I agree. Sustainability is always an issue, and actually a lot of people just measure post-intervention and say this was successful, and then they never follow up. So what we did do was we've got hand washing measures up to a year later in those first intervention villages. But to go back would be nice, but we would need additional funding. So I think we've closed that, and we're moving on to try and see if we can replicate those findings elsewhere. We're working in Nigeria now with a similar program that we're trying to adapt there. I think it depends what field you work in. So if you work in, say, vaccines, you, of course, are trying to achieve 80-90% coverage. With behaviour change, any behaviour change is always good, particularly with the implications for public health. It's difficult to try and explain, but it is, as the gentleman said, that over time you do see that happen. We would hope that it would kind of plateau and wouldn't go back to baseline levels, yeah. And then, yeah, if you did go back and could do another intervention, you may be able to raise it even higher. Yeah, you would ideally want it to be very high and stay high.
Do you engage with big soap manufacturers to try and get them to advertise and promote and, you know, get their name splashed everywhere to keep it in the public conscience?
Yes and no to that, in that we are funded by people like Unilever from their social mission work, and that is obviously they're trying to drive soap sales, but the research we do is always unbranded, so we don't really get behind branded campaigns, and most of the time when we work with Unilever, they're very happy that it's unbranded, but a lot of these areas, Lifebuoy is quite a big market anyway. So we do a lot of work with the private sector. Thank you.